I'm Dean Gopalan. I'm the Professor and Head of Anesthesia and Critical Care at UKZN. We thought we were being a bit smart by calling it the SMART Centre. Simulated modules in anesthesia and resuscitation training is actually what it stands for. In the education space, which of course is a passion of mine and all my colleagues that have been involved in the centre for many years, it's the key drive for why we carry on doing what we're doing. And the best way to train, whether it's undergraduates, postgraduates, allied professionals, anybody in medicine and in anesthesia and perioperative care, is by immersing people into as realistic an environment as possible.
The equipment in the SMART Centre is what we term high fidelity equipment. So there's a difference between high fidelity, mid fidelity and low fidelity. High fidelity equipment basically talks about that kind of equipment where what you see is highly accurate.
For the past 20 years, students have been visiting the SMART Centre as part of the anesthesia module in their 4th year of study. Students are both intrigued and delighted by the realistic and real-time response of the teaching aid that is STAN. It forms an important bridge for students between the theoretical knowledge and practical application, but in a controlled and relaxed setting. The theatre environment, especially the anesthesia component, can be daunting, time-sensitive and highly pressurized. Here at the SMART Centre, we are able to recreate the anesthesia component in a logical, step-by-step manner which students can easily follow and witness the reaction to interventions such as drug administration and airway manipulation. Furthermore, we are able to recreate scenarios which students may not be exposed to during their 2-week anesthesia rotation, such as a difficult airway, scoline apnea, or even malignant hypothermia for that matter. The feedback we've received over the years only confirms what an invaluable teaching tool we have here at the SMART Centre. Students can learn at their own pace before being exposed to the theatre environment, and that has proven to be a very beneficial exercise.
So this is the transesophageal echo training model from Biomedics and CAE Healthcare. It's one of the models that we use to train our registrars on the performance of transesophageal echo and transthoracic echo. It's a model, as you can see, that is able to do 3D and ultrasound images to compare and correlate, and just to help our registrars understand how these images are formed and to correlate what they see on the equipment and what they've read. We use it as well extensively for our training courses, for our Part 2 programs and our rotators through our cardiac blocks as well. And with the addition of the Microsoft HoloLens, it adds an element of augmented reality that you cannot get with any other training method. And it's quite useful to help for the students to understand how everything fits together, how the organs fit together, and how your images are formed, so that when they head into theatre and actually perform this on patients, they already have a certain level of comfort on how to perform these to identify pathology and normal anatomy, etc.
MEPA is a high-fidelity simulation course, and MEPA stands for Managing Emergency in Pediatric Anesthesia. So this MEPA course was first introduced in Africa here in the SMART Centre with UKZN. That was 10 years ago. Now, high-fidelity simulation means that the reality, fidelity stands for reality. So everything feels real. The simulators are very expensive. They can do a lot of things. And the environment that we do these courses in are also very realistic. We're dressed in operating room clothes. The environment is operating room clothes. Everything happens in real time. That's very important. So how a MEPA course is run is that 1 or 2 candidates are in the what we call hot seat, and they will be given a scenario where they have to manage an evolving emergency. So when this scenario is called off, then there's a debriefing in the debriefing room with the rest of the candidates who have been observing the scenario while it was unfolding, and it's going to be discussed why certain, let's say, mistakes have been made. So what were the reasons why things went the way it went? MEPA is very well received by candidates, and I've often heard from candidates feedback a week or 2 or 3 later. They're writing or calling me and saying, look, I had this emergency, and if it wouldn't have been for the MEPA course, I would not have known what to do.
My name is Dr. Ian Chiwalabe. I'm a consultant working at King Edward Hospital. How I got involved with SMART Centres through my research project. And my research project was looking at how interns manage an obstetric airway, because interns are going to go out into the community and do their community service and manage these patients. And for them, they only rotate through our anesthetic department during their 2-year internship for about 2 months, all right? And we wanted to see how adequate their training is. It also highlighted the importance of simulation training as part of internship, because it allows the interns to make a mistake on a mannequin, all right, a high fidelity mannequin, as opposed to making the mistake in ComServe on a real person.
I'm Dhiren Pillay. I'm a specialist anaesthetist at King Edward VIII Hospital. I'm currently an honorary lecturer at UKZN. My current input here is that we utilize this for a lot of intern training. Specifically, we aim our training at the interns for obstetric emergencies. Essentially, simulation, what we find is it's an experiential learning. So you learn through experience. And what we are able to do with this is have an obstetric emergency and let the candidate or the student experience it, manage this emergency without harm to a real patient. And that's extremely important that we're able to do that without risk.
I'm Dr. Andy Burford. I'm an anaesthetist in private practice in Durban, and currently I am Secretary of the Sedation Society of South Africa. That's SASPOSA. We are a society that promotes the use of safe sedation within South Africa. And how I come to be here is that I organized a congress last year in conjunction with the Department of Anaesthetics at the UKZN. And when I saw the SMART Centre, I realized that this is exactly what we need to train sedationists for the future. We organized a one-day sim lab, and we had various scenarios that we had programmed into the advanced high-fidelity sims that they have here. And I have to say, it was a tremendous success. It was thoroughly enjoyed by everybody who participated. And everybody went away having learned something. It is intense, hands-on training for future sedationists. And our society believes that it is a way forward for training future sedationists in South Africa.
We've tried over the years to expand our footprint. It's become a national standard to which others aspire. We've rolled it out to a number of disciplines. The other important initiative that we've taken over the years is to spread our footprint across the African continent. As one of the few centers on the African continent, we feel it's an obligation to run a program that benefits beyond the borders of our own institution, our own province.
The SMART Centre has a vision, and our vision is to be able to produce highly skilled medical personnel with state-of-the-art equipment, so that at the end of the day, it is our wonderful patients that get the best possible healthcare that's available out there.